Public health informatics it involves data, information systems, and this includes the software, the hardware tools that are used to make work easy for epidemiologists. In this sense, epidemiologists need data. So the role of the informatics in epidemiology is with the data, the epidemiologists are able to make decisions during outbreaks, during the routine disease surveillance, and also in research. So they use it to make research and so on. So with the informatics tools, they're able to have a way of collecting the data, analyzing it, visualizing it in a much easier way compared to the ordinary ways of paper-based data collection. Public health informatics, like I said earlier, the software and the hardware tools. For example, the hardware like the tablets, the mobile phones, computers. So with this hardware and the software that is used on the very hardware, there are so many software tools out there for data collection, for data analysis, for data visualization. With this technology available to the epidemiologists, they are able to have the data collected in an electronic form, and that makes it easier for them to analyze the data, and data analysis is much easier and automated with the informatics tools, and that leads to also visualization, which shows them how, for example, in an outbreak, they're able to see the flow of the diseases, the trends, the communities affected, and so on. And just to put emphasis is that with public health, the focus is on the communities and the population health. So there's a lot of collaborations and a lot of parties that are involved in this, right away from the local level up to the government. So the government, different partners, local chiefs, and everyone along the entire pyramid is involved in ensuring that the community and the population is healthy. So public health informatics supports the epidemiologists to ensure that the population and the communities are healthy. The epidemiologists, for example, during an outbreak, they would collect data on paper. So they would go out to the field, investigate cases, and have their data probably on paper. They could have a data collection form. That's if it's also available. So different variables that they need to collect data for that they need. So they collect data on paper, and it remains on paper. So it would be very difficult for them to have this data analyzed, have this data shared. So you're not able to make sense out of this data that is on paper. And even if you're able to transfer it to any other, probably any other electronic, it also consumes a lot of time for you to enter it in an Excel file or something. And so that would make it difficult for you to use it for any purpose, whether to make decisions or to have research, to write maybe a research paper about it, to communicate to the public on how this has transpired. All this, with this, it was very difficult to have data management, to have decisions made. So with this paper-based, even when it comes to storage, you cannot store a paper for a long period of time. In most cases, in epidemiology, we usually refer to data of previous years, previous months. How would you store a paper for 5 years longer and it's not destroyed? So this is when informatics helps. Like data will be in an electronic form and can be accessed by anyone from anywhere at any other in any other form. The situation was not easy. Even transfer of information from the lower level, let's say community, let's say facility level, to the highest level, probably national or even global or even continent level. WHO, Afro, or even Africa CDC, they are not able to get information from countries. At country level, the national level would not be able to get information from the community level, the health facility level, or even district level if it wasn't for health informatics. The paper would not move, and of course if it is to move, it would take a very much time to arrive to the national level. So then that delays decisions, and so that risks the lives of the community and the population at large. Public informatics in Sierra Leone. Sierra Leone has made significant progress. I'll focus on Sierra Leone, though giving a broader picture of the role of informatics worldwide. If I give an example of Sierra Leone with the IDSR, which is the Integrated Disease Surveillance and Response Strategy, which was introduced by WHO, World Health Organization. So many, or if not all, African countries subscribe to it. And so this strategy helped countries to find a way of curbing outbreaks, monitoring their disease surveillance, and so many other aspects. So it focuses on the detect, the response, and the prevent. So specifically for surveillance, which is about detection, there's within the IDSR strategy, there's a focus on the electronic aspect to ensure that the flow of information and also information sharing is smooth from one level to another. So Sierra Leone subscribed to that way back in 2015, and this was after the Ebola outbreak. During Ebola, it was really difficult to have information flow from any reporting unit, the different health facilities, the different health centers, and those that were accommodating the different patients, the suspected cases at community level. Information flow was really difficult. So the countries saw it that they really needed an electronic platform to ensure that this information flows smoothly, but also have the country make decisions based on the data, evidence-based decisions. So around 2016, immediately after the outbreak was declared over, the country sat down with the partners and agreed that they needed an electronic platform to see that information flows smoothly for decision making. And so they decided to start with a weekly aggregate reporting tool. So with the weekly aggregate reporting tool, health facilities are able to report cases in aggregate form of priority diseases from their level, which is also reviewed by district level, so that district is also able to make decisions based on that data at their level. They're able to see the trends, which particular sub-region, sub-district level, it could be, in Sierra Leone it is called a chiefdom. So which level is highly affected? Are there any clusters? So with this data, they're able to make decisions at their level, and then national also gets that information on a weekly basis. But this is aggregate data. And during the implementation, there are lots of collaborations. Any software development involves a lot of work. There's different roles that are played. There's software development itself, there is testing the tool itself, there is the programmatic part of it, that is the epidemiology aspect of it. So all these different specializations are required to ensure that there's a smooth implementation. And so collaboration across all these specializations among different partners was very helpful during the collaboration. And just to add to that, again, there are so many other requirements. The software itself, configuring the software, then procuring the hardware that is required, the tablets that are used at health facility level to report, and then onto that there is need for the internet data bundles for reporting, and there's a software that we use to minimize misuse. of the electronic tools, the tablets. So it's called MDM, which is mobile device management. And so all these different requirements and all these different aspects that are required to ensure a smooth implementation, it cannot be done by one party, it cannot be done by an individual. So there were lots of collaborations among partners, the government, and these collaborations involve both technical and financial. So you could get one partner supporting probably the mobile device management software, one partner supporting the internet bundles, one partner buying the mobile tablets, another one working on the software. So it was a very comprehensive, collaborative effort to ensure implementation. So along the way, implementation rollout was successfully done. Sierra Leone has 16 districts currently. So the implementation of the weekly aggregate tool was completed by around August 2019. And this was up to over 1,400 health facilities across the country. So during that time, the country still sat down after going through all this data that would be reported from the health facility level was always reviewed on a weekly basis at national level. Reviewed, analyzed, and then presented in a technical working group with the presence of the Ministry of Health officials, government officials, and partners. So they saw to it that there's something missing. The aggregate data that is coming in is not comprehensive enough to make them make public health decisions and take next steps. So a discussion started on how do we make it case-based. We need to shift to case-based disease surveillance data collection. So again, this was also collaborative because it involves a programmatic efforts, all the different software development aspects and testing and so on. So around 2019 again, there was a pilot that was done for the case-based, electronic case-based disease surveillance tool. And the beauty is that the weekly aggregate tool was a success. So when it was evaluated, then it gave a go-ahead for the case-based to also be implemented. And to add to that is that resources were already existing. So there was no need to have electronic tablets procured again. The same existing resources were going to be used for case-based. The tablets, the data bundles, the mobile device management software that is used to restrict misuse of the tablets. So this was, it made the work of implementing the case-based very easy. Just before I go into the details of the case-based, just in 2019, WHO declared Sierra Leone the first African country to fully implement an electronic disease surveillance system, because we were already seeing products coming out of that implementation as data was flowing smoothly to national level and it was being used to make decisions. And that informed the next implementation of the case-based so that we get more information and be able to make broader and public health decisions. So with the case-based implementation, like I said, we use the existing resources. So it made work easier. And implementation was meant to be during beginning of 2020, but that's when we had COVID-19. So, but during that time, the system was already set up. So it was an opportunity for the country to roll it out. When we had COVID, it is what the country used to have COVID-19 data captured in the system. So as I speak now, Sierra Leone has all COVID-19 data in one place. And even if after 20 years, the data is available, it can be used for research, it can be used for any other purposes. It can be, even if in future we have any other pandemic, we're able to relate and have comparison of this data based on that period of time. So the country rolled out this electronic case-based from 2019 up to around end of 2020. So over 1,500 health facilities were able to have the electronic case-based disease surveillance system up and running. So currently the country runs both the weekly aggregate tool, which is aggregate in nature and that is reported on a weekly basis, and then it has the electronic case-based, which is reported immediately. Immediately a case is detected, it is reported from the health facility level, and data flows right away to the national level. So the district uses the same data to make decisions. Partners use the same data to make decisions. And just to build on that, during COVID, the country was able to electronize most of its systems. COVID vaccines were also electronized. So even for the vaccinations, we are able to access that information. And this information is easily accessed even by the trainees in the field epidemiology training program. So for their field projects, for their data analysis, during, now that the implementation has gone a few years, during any outbreak, any small outbreak or any response, we use electronic systems to collect this information in real time. Whoever is investigating, the case investigator or the epidemiologist, will move with the tablet to the field and then capture this information direct into the tablet. Or if there is no internet available or the tablet is not available, they fill the form and then later on have the data captured in an electronic form. And currently the country is preparing for monkeypox. Recently, WHO declared monkeypox an international public health concern. So we already had monkeypox as one of the priority diseases that we are working on, and we already had suspected cases previously, but not so many and not to the extent that the world is receiving cases at the moment. So we're able to fine tune and have a revision of our tools, that is both paper and electronic. So we are able to monitor and have suspected cases reported. We have lab tests for the samples, and then we are able to see the results. So with the electronic case-based, it's also linked with the lab. So the lab results are able to be linked with the epidemiological data, and then you have a conclusion of the case. So you're able to know how many of the cases that were reported were suspected, how many of them were confirmed. So, and with this implementation, the international health regulation, the country has achieved a lot. With the joint external evaluation that was conducted in 2016, the electronic tools were not functional at that time. And the recent one, which was conducted in 2023, has shown that there is significant progress in electronic information systems implementation. And so the country improved their scores on the surveillance specific indicators by 2. So there's that improvement, and Sierra Leone is a learning ground for other countries to come and see how has Sierra Leone successfully implemented this. What can we learn from them? How can we improve our implementation? Or how can we start this implementation in our country? What are the lessons that they learned from this? What are the challenges? So many countries have come, have visited Sierra Leone to learn, and they have also invited them to see how they can share experience in having this implementation successful. Of course, with any information system or with any implementation, we are bound to challenges. There are challenges that we've faced. For the weekly disease surveillance system, of course, the data was not comprehensive enough. That's why the country took another step to have the case-based